Dr. Sprague Martinez, what does the literature say about some of the things that Shamir just broke down, right? In terms of the way women, Black women, patients of color, historically are treated by providers when they go to seek care.
Yeah, I mean, it's pretty consistent with the literature, your experience. And actually, I think about a year ago, there was, well, about 20 some odd years ago, there was a report on unequal treatment, right? It was a groundbreaking. I remember it was like 2003. At the time, I worked for the Office of Minority Health. And, you know, the headlines were bias in the medical community, racial bias, racial stereotyping in the medical community. And the report that came out maybe about a year ago was kind of revisiting 20 years later. And not by no surprise that we haven't made much progress in terms of medical care and the experiences of Black people, people of color, women, in terms of their medical care experiences. And as you were talking, I was also thinking about just the mental and emotional stress that it needs to be put into preparing to go to a doctor visit, and the toll that takes on one's body, right? If you're having to really at a time when you have fatigue, right? At a time when you're not at your best, but to have to really fight for quality medical care, and that in and of itself takes a toll on the body over time. That constantly having to be up, prepared. I need to go to the doctor. I mean, when I go to the doctor, I should be able to go to the doctor and say, you know what, I'm really not feeling well today. I'm not feeling my best. But that can't happen if you're a woman of color. You have to get dressed up. I remember when my kids were little, one of them had asthma, and we would end up in the emergency room, and I would always get dressed before we went. And my husband would be like, what are you doing? It's an emergency. But you have to, if you're not, the assumption is that you know, you're not doing your job, or you're not, something is wrong, or they're going to drug test you, or you're a parent, like, why are you here in the middle of the night? And the same thing when you're going in for long COVID as when you're going in for any kind of treatment, really. So.